Well, private hospitals, let's go to that last headline, are blaming the government and the South African Nursing Council for the continued shortage of nurses. Now, it's understood, according to the Life Healthcare group of hospitals, South Africa is in dire need of as many as 26,000 additional nurses. And we remember how bad it was during COVID, don't we? Well, private hospitals say they have the capacity to train the nurses, but the Nursing Council itself is preventing them from doing so. So how did we get here? Let's get the reaction of the president of the Young Nurses Indaba trade union, Sicina, joining us this morning. Rich, good morning. Good to have you back on eNCA with us. Let's start here. Is it true that the Nursing Council is preventing and blocking nurses from getting trained up? Good morning.
Good morning, my leader, and good morning to the viewers and also your team there. You know, on the 12th, it was in International Nurses Day. Young Nurses Indaba Trade Union marched to South African Nursing Council. One of our demands out of what we were actually presenting to South African Nursing Council was to say, open those private and public nursing colleges and increase the number of intake. And obviously, we received the response from South African Nursing Council. And South African Nursing Council in particular is actually pointing a finger to Council on Higher Education. They are absolving themselves. They are saying we are not the ones who are blocking private or public colleges to have more intake of nurses. They are aware of the fact that we have gross shortage of nurses generally in South Africa. They are actually saying nursing colleges, private or public, they are their own enemies, because they are saying there are requirements that are needed, more especially to enroll into this new curriculum. The new nursing curriculum. One of those requirements is to have infrastructure. You must have lecturers, preceptors, and clinical facilitators. You must have libraries. And the South African Nursing Council is saying many of these colleges are not meeting requirements.
So where do we go to from here? Because you've just highlighted just how bad the situation is with our shortage of nurses. Do you have any opinion as to why this would be happening? It's starting to sound like this is all just red tape and bureaucracy, but it's having a real knock-on effect. Why would this be happening, do you think?
The problem, my leader, it started when we were transitioning. Remember, South African nursing, in particular here in South Africa, we were not regulated by Council on Higher Education, your CHE. We only moved to higher education in 2019. Now there is a problem because there was poor planning in as far as that particular transition. Because at the moment we have South African Nursing Council and Council on Higher Education fighting each other. And unfortunately, when two elephants fight, it's the grass that suffers. Because South African Nursing Council is actually saying Council on Higher Education doesn't even have an authority to regulate nursing education. So they are saying in terms of Nursing Act and a Higher Education Act, there's nothing that is talking to Council on Higher Education, giving them an authority and power to regulate nursing education. So South African Nursing Council is saying we are going to keep on holding on to Council to nursing education training regulation. So where we need here, we need to go back to the transition, the plenary, because it was completely bad, and amend Higher Education Act and Nursing and Nursing Act as well. It's a mammoth task. Many of us are actually prevented. Even myself, I can't even advance my nursing career anymore because of the red tapes that we are actually experiencing at the moment. The issue and the biggest elephant in the room is South African Nursing Council and Council on Higher Education. They must stop fighting each other.
Well, since you mentioned the Council for Higher Education, could this go as far as the Minister of Higher Education? Is that who you'd like to see getting involved in this? Rich, before I say goodbye to you, last question. Should we get the Minister of Higher Education involved?
Exactly. Without the Minister of Higher Education involved here, we are not going to move. We are not going to go anywhere. Remember, one of their roles, one of South African Nursing Council's roles is to advise the Minister of Health and the Minister of Higher Education as well. Without those two people involved in this mess, we are not going to move. We are not going to go anywhere, because when you go to Council on Higher Education, Council on Higher Education will point a finger to South African Nursing Council. You go to South African Nursing Council, South African Nursing Council will say, but it's not us, it's Council on Higher Education. So we need really to actually involve both ministers, Minister of Health and also Minister of Higher Education.
Well, for the moment, then, I appreciate your time, and obviously we'll take this conversation forward as we watch what happens and follow up as well, because we can't have a need of 26,000 nurses in our country, and it all seems to be held up because of red tape and bureaucracy. My thanks to Sicina, young nurses in Indaba, trade union president, joining us this morning. Of course, we'll take that story forward for you throughout the day.